North Shore Medical Center, home of a comprehensive stroke center with Dr. Sonal Mehta, Dr. Amy Jarvis, and an outstanding team of experts. A life-saving relief for patients like Elmona Noel.
Hello, Beth.
Just a month after 32-year-old Noel had her baby, she had a stroke.
I was fell on the floor, but I did not have any control that I can control myself.
She had a seizure at home and she was brought in by EMS.
Unbelievable, I couldn't believe it.
Her initial scans showed that she had a small stroke. She may have had a clot in one of the major veins of the brain.
The dark areas of this image show where the pressure was building in her brain. And this is the very, very large clot that was removed. The image taken after shows the pressure was gone. Just one of the many success stories at North Shore Medical Center's award-winning Comprehensive Stroke Center, providing quality care in stroke prevention and stroke management. Comprehensive stroke centers must meet the highest level of stroke certification available.
Anything that's vascular that needs to undergo a complex procedure, that's the goal of the program. So a subarachnoid hemorrhage, intracranial hemorrhages, aneurysm, strokes that have a clot, anything that needs to be treated, and to be able to treat them to continue their care in the ICU.
The interventional procedures are done in a biplane angiography suite.
It is equipped with all the latest technology that we need in order to treat the most complex conditions.
So the absolute biggest sort of jewel in our crown right now is our beautiful biplane interventional suite. And that is state-of-the-art technology. It's beautiful, it can do anything, and it's an extraordinary piece of work that took probably 3 to 4 years to design and build.
It really allows us to offer the complete spectrum of neurointerventional procedures.
But before the patient ends up here, the process typically starts with EMS.
We have to make an immediate assessment of that individual.
EMS says the Comprehensive Stroke Center is a benefit for the entire community because fast is everything. As neurologists say, time is brain. When a stroke strikes, 1.9 million brain cells are lost per minute. That means every minute your brain ages 3 weeks. 87% of people who have strokes have clots, and 13% have bleeds, meaning the clot bursts. So knowing a comprehensive stroke center at North Shore is nearby,
It's confidence knowing that when we arrive with a stroke patient, they're going to handle business.
EMS brings the patient to the emergency department right away, and they immediately descend on the patient.
And we have to do this as quickly as possible to evaluate the patient, determine could a stroke actually be happening.
A full team comes together as we call neuro overhead, and we have people doing multiple things all at the same time.
The patient is immediately evaluated to see if they're a candidate for TPA, the clot-busting agent, or if they need surgery.
The teamwork here is phenomenal. Everyone knows that when a patient experiences a stroke, it's a multidisciplinary treatment that has to be taking place.
The average number from door to groin, that's the time that a patient enters the hospital until the time the catheter is entered in the groin for surgery, is 45 minutes at North Shore Medical and 90 minutes nationally, twice as fast at North Shore Medical.
After they do not need to be in the intensive care unit, they are transferred to the neuro step-down unit.
The step-down unit provides an intermediate level of care between ICU and the general medical surgical ward.
Really, at the end of the day, what I like seeing is the patients who come in with a stroke and leave completely normal and healthy.
The Comprehensive Stroke Center at North Shore also does community outreach and education, and the center is getting the nod from the American Heart Association.
They brought on the best team to ensure that they perform at the highest level, and they are.
A sentiment echoed by patients.
I could have died, when I see that clot they took out from my brain. Dr. Mehta did a very, very good job. There is no word to thank him.
Thank him and the extensive team of experts who make up the Comprehensive Stroke Center at North Shore Medical Center.
It's so gratifying to see her with her baby.
I have my baby I can hold.
That's what makes all our work worth it. These are the cases that we really work for.
That's why I love North Shore Hospital.